So it will just be again a waste of time, money, and of course yung effort and Hello everyone! This is Dr. Juana B. Miranda and welcome back to my YouTube channel, Dr. Vlogger. And we are back with another episode of the COVID series in my channel. And yes, you saw it right. We are going to talk about a topic that is something that have a lot of questions from my non-medical friends and family. I will try my very best with all my strength and weaknesses to explain to you in a manner that you will be able to understand, to digest them, and to even process them. Also, if you notice, I'm wearing a beret. Hindi ko nga alam kung bakit ako nag-wear ng beret. If you previously watch my videos in the past, talagang mahilig ako sa beret, sa hat. Anyway, let's not talk about these berets because kaartihan ko lang to. So let's proceed to the main topic, the diagnostic tests for COVID-19 series. So please bear with me as we embark on this topic that will further confuse you. Joke. And if ever you have questions, just comment down below and ask me or any clarifications. Kung may mga nasabi ako na hindi nyo naintindihan, I am always willing and is ready to answer. These diagnostic tests are performed by experts such as the laboratory, medical technologists. These are the people that are licensed to perform these tests, and these tests are used by us, by the physicians, by doctors to diagnose a patient with COVID-19. Currently, well, from what I know as of this moment, we have 3 types of diagnostic tests to detect the presence of SARS-CoV-2 and also diagnose a patient or a person with COVID-19. But of course, before we start to discuss these diagnostic tests, we have to bear in mind, please take note that RT-PCR or your PCR-RT, the polymerase chain reaction reverse transcription test, is the gold standard in detecting your SARS-CoV-2. The DOH, WHO, CDC, all the international medical facilities stress that point that RT-PCR is still and remains to be the gold diagnostic standard. Your RT-PCR assay detects the viral genetic material, also known as your RNA, your ribonucleic acid. You know, our genes are composed of your RNA and DNA, and I won't talk about that. Basta, your RT-PCR, it detects that genetic material, the RNA in your virus, in your COVID-19, and your RT-PCR is best for diagnosing patients with active disease. Active, that means the patient or the person is harboring or is shedding the virus with or without symptoms. That in itself is the main reason why it is our gold standard. Kung yung tao na yun may virus or may COVID-19, na-detect niya na mayroon siya. Gets nyo? I hope you're getting this and you're understanding it, okay? So, yan ang pinaka-main advantage ng RT-PCR. This genetic material that is detected by your RT-PCR can be infectious, meaning sa infectious, based on your DOH, it's 2 days before and 10 days after the symptom onset. So, infectious yung stage na yon. And also, non-infectious, meaning more than 10 days of the symptom onset. Okay? Okay. Usually, after the 10 days, you can be considered as non-infectious. Every diagnostic test has what we call a sensitivity. Measures the proportion of positives that are correctly identified. That's sensitivity. That means the percentage of sick people who are correctly identified as having such illness. or that illness. So, sensitivity. Why did I bring this up, yung sensitivity? Because your RT-PCR in specific days have increasing sensitivity. The sensitivity of this assay will depend on the timing of collection and the viral load that is obtained on that time na kinuha yung test. Your RT-PCR, it is your nasopharyngeal or oropharyngeal swab test, diba? And of course, you perform this using or wearing complete PPEs kasi swab nga siya. This sensitivity increases on certain timing or period of collection. Based on this journal right here, it stated there that when you obtain a sample on specific days, the higher or the lower the sensitivity of the test. Day 1, like a person or a patient is exposed to a positive person, a positive patient. However, day 1 of exposure, if you right away perform the test, you will have 0% sensitivity. And that means, magiging baliwala lang din yung test. It will increase as you go on. Like, pag day 4 siya, according to this journal, it will increase to 33%. Day 5 of the exposure, and most likely, usually kasi, di ba sabi ko nga, may previous vlog na yung sa signs and symptoms of COVID, day 5, most likely, is the first onset of your symptoms. Day 5, it will increase to 62%. Day 8, most likely again, third day of your symptoms na to, it will increase to 80%. Day 21 of exposure, and most likely, you will have no symptoms kasi day 21 na nga, ang nagiging 34% ang sensitivity niya. Kaya guys, mayroon pa din nagpa-positive even though there's resolution of symptoms already. That's why if you are always up to date with the DOH guidelines or with the DOH announcements, DOH is not recommending a repeat testing to those patients that are fully recovered. Especially yung mga patients that have been isolated for 14 days. Kasi like what I've mentioned before, COVID-19 remains infectious on 2 days before the symptom onset and then pag day 10 na of symptom onset. Lagpas na ng 10 and if 14 days na siya na-isolate from the symptom onset, hindi na siya talaga infectious. So there's no need of repeat testing because your RT-PCR, it will still have this positive results kahit up to 8 weeks pa nga daw. So maging positive pa siya and it will just add worry and anxiety to the patient and to the family and to also yung mga nagre-return sa work, ganyan. Parang it will just a waste of time, effort, and of course, of the cost, diba? Kasi medyo pricey na din siya. Also, experts don't recommend randomly to test asymptomatic persons, especially if yun na nga, there's an exposure and then you will test agad the patient. Diba, like what I've mentioned before, if you're going to test that on day 1, eh parang 0% sensitivity siya dun sa test na yon. Ideally, according to the experts, you should just quarantine these people and observe for symptoms. On the day 5 of exposure, mag-i-increase yung sensitivity of the test. Kung positive siya nun, reliable yung test, and then madadiagnose mo siya correctly, diba? Asymptomatic persons, of course, can still be tested, but I personally believe that it is the clinical judgment of the clinician or of the doctor, of the physician, to advise for these asymptomatic persons to be tested. They have these certain guidelines to follow. That's why, guys, testing asymptomatic individuals without knowing the timing of exposure is a waste of time, waste of money, and waste of effort because there will be false negatives when collected at a wrong time. Siyempre, kung false negatives and then magiging complacent, it would just contribute to the further spread of the disease. So, the next type of diagnostic test is your rapid antibody tests, which I believe have become very popular sa lahat. I mean, very popular siya especially sa mga employers that require their employees to have this rapid antibody tests, pati sa mga celebrities, may kita mo sila lahat. The medical people are not banning this rapid antibody tests. It was even stated that for the DOH will just create a clear-cut na guidelines regarding these rapid antibody tests because somehow these tests, they can help aid naman the clinical detection of SARS-CoV-2. Yung rapid antibody test, from the word itself, rapid, mabilis siya. Mabilis siya, so parang convenient talaga siya sa most people. I mean, I forgot to say, yung RT-PCR, it takes almost usually 3 days. However, syempre, based on experience, may mga iba sa amin, 5 days, meron ng result, may iba naman 10 days, may pang 7 days. So, depende na din kung saan mo siya isasubmit, depende sa laboratory, depende kung may nagka-problema din. I mean, guys, you have to also understand, hindi ko lang alam kung na-news to or whatever, but I even heard one time na may isang certain laboratory na nag-positive yung iba nilang medical technologists doon, thus the halt of the process. Yung mga swab doon, yung mga test, hindi siya masyadong nagawa, or yun na nga, nadidelay siya. So let's just understand them. Rapid, mabilis siya, and it's collection of the blood, kaya siya mabilis, and more or less, sabi nga nila 15 minutes, but our hospital is not doing this. We don't recommend this sa mga patients namin, especially yung may mga active, clinically active na may disease. Syempre, RT-PCR kami diretso, so we don't have this, but they said na 15 minutes daw to. It's less expensive. This test, it detects past infection. Based on the name, it detects antibodies. And antibodies, they are present in your system or in our body after a infection. Usually, mga 1 to 3 weeks past the infection, only appearing in later stages of the disease, and thus has a tendency to misdiagnose or create false negatives. If collected in a wrong time, like during an active disease, tapos nag-rapid antibody and then maging negative kasi siya, kasi nga rapid antibody test na antibody ang dinidetect niya, negative, positive pala yung taong yun, diba? Makakasalimuha, pumuka siya. It is very helpful lang in documentation. It detects previous infection. So, it is very helpful in documentation that a certain patient or a person had the disease, but so little use in diagnosing acute infection, meaning yung bagong onset ng infection. So, sensitivity, just like what I've said, sensitivity of this test in the first 7 days, mga 30% siya. Then, it will increase to 96% on your 21 to 35 days post-infection. So, there, you can't passively rely on this test solely. It is not a good screening test. And just lately, DOH has released a statement that it doesn't recommend the rapid antibody tests for the clearance of employees going back to work because it will just contribute to the rapid rising COVID cases. Kasi nga, magpo-false negative sila and then makikisalimuha sila, pupunta sila doon. Okay lang sana, palaging, guarded sila, mask, social distancing and everything. Usually, mayroon pang tendency na mag-lax yung mga patients who are tested negative kasi negative nga sila. So, the next is yung rapid antigen tests. We're still introducing it to our country. Napaka-new pa nitong test na to. It is a rapid antigen test. So, antigen naman siya. Hindi siya yung antibody. So, these tests, these can help actually in diagnosing acute infection just like your RT-PCR because it detects a specific protein or a specific antigen or yung virus itself during an active disease. Pero yun na nga, this requires daw, as what I have read and researched about, it requires that these tests be done early stages of the infection that have highest viral load. It is also a swab, just like your RT-PCR, but it is less accurate and less sensitive than your RT-PCR. And I cannot really tell you more about this kasi as what I've known, hindi talaga siya masyadong ginagamit pa, but ginagamit naman siya sa ibang bansa, ginagamit na siya. So let's just wait and let's wait for the updates. Ako, I'm always like waiting for updates and updates because I really want to learn about these COVID-19. More importantly, we should give emphasis on the 14 days isolation because I strongly agree on its importance. Together with the guidelines of hand washing, social distancing, wearing of masks properly, together with those things or with those habits, if you develop symptoms, you isolate yourself and you test. If you have the means to test yourself, of course, to get tested on the 5th day of the symptoms so that to avoid false negatives. And then, if you cannot be tested, then isolate yourself for 14 days. And after 14 days, majority of the patients, majority of the persons, non-infectious na naman kasi sila. Just like what we're applying to our patients, we discharge them if fully recovered na sila, if wala na silang fever ng 3 days, and Mina-advise na lang namin sila to isolate furthermore sa bahay nila. You know, isolation, especially pag 14 days, plus with these guidelines na hand washing, mask wearing, social distancing, as a population, we will be able to fight and to win this COVID-19 war, you know. There you have it, guys. Yun lang po muna yung masashare ko. As of this video, I hope I am able to explain each of these tests. Watch out for another episode of COVID-19 series. Every Fridays po yan. My medical topics are on Fridays, especially my COVID-19 series. I upload regularly on Mondays and Fridays. Yung Mondays ko, health, fashion, beauty, my song cover. Yung Fridays, I reserve that for learning, for the knowledge. I reserve that for medical topics, especially nowadays, yung COVID-19 series. So yeah, regular uploads Mondays and Fridays. And see you again on my next vlog. And have a good day. Bye-bye!